Hey, 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 and welcome to this week's Genius Zone. And this is the place and the space where we bring coaches, healers, and leaders to add exceptional value to our audience. And today we have a very special gift. We have a beautiful woman who is a doctor of chiropractic, oh yes, like my husband, and she has a PhD in somatic depth psychology. Yes, you heard that, and you will find out more about this. And she will share her transformative journey from losing her own eyesight to discovering the deep healing through somatic and prenatal psychology. So this is rooted in the groundbreaking work of Carl Jung. And this lady, with no further ado, I hope I say her name right, Elizabeth Wisniewski. I'm going to bring her right here to the stage and introduce her. How are you, Elizabeth?
I'm great. Thanks so much for having me.
It is an absolute pleasure. So I guess let's begin with, before we move into, what your work is about with the mother archetype, let's move into your own experience of losing your sight. So do you want to talk us through that?
Yeah, absolutely. When I was about 5, getting ready for kindergarten here in the United States, I grew up in the state of Michigan, and the pediatrician just noticed something looks a little bit different when we're looking in her eyes and looking at her retinas, even though I could see totally fine. So my parents pursued that, and I went to some different ophthalmologists. They wanted to do exploratory surgery on me, and my parents said no. And I'm grateful for that because I'm 5 years old. And it took about a year, and I got diagnosed with a really rare retinal disease called familial exudative vitreoretinopathy, also known as fever. And it's mostly found in boys in the Middle East, and often has a genetic component. I have none of the genetic mutations, and I'm a woman of Polish ancestry on both sides of my family, and nobody else has it in my family. So
Wow.
that was a mystery, and I'm sure I'll talk about it later of how I've made meaning of that and some really deeply soulful experiences I've had around it. So growing up, I was having all these surgeries, and most of the time they'd be laser to stop the bleeding or to reattach my retina. There was times I would be like the third or fourth person in the world to have a particular surgery. And during this time as well, my mother was going through breast cancer treatment. She went through she had breast cancer 3 different times, starting when I was in about third grade, and she passed away when I was in ninth grade. But also in ninth grade, I lost both of my retinas detached within about 5 weeks of each other. The first one, I was at swim practice. I was a competitive swimmer my whole life, and all of a sudden I couldn't see the wall for a flip turn. And during this time when my mom was still alive, she had been a special ed teacher, and she helped me through geometry and really visual classes with making pegboards with rubber bands and feeling and learning different ways to meet objectives, but getting there in a different way. And that really served me later on down the road, because about 7 years later, I had finished undergrad in environmental studies and political science, wanting to go to law school, be an environmental attorney. And I had my 30th surgery about a week after finishing my undergraduate studies. And I was supposed to get vision back in my left eye. I'd already lost all the vision in my right eye when I was 14. And I woke up from that surgery just deeply knowing in every cell of my being something was really wrong. And I, in fact, lost most of the rest of my eyesight instead of gaining anything back. So here I was turning 22 and thinking, my whole life is over now. But I didn't let that stop me. I heard a commercial for medical massage school, enrolled in that, and a couple weeks in, I had never taken anatomy or physiology before. I went to my dad and I just said, thank you for paying for my undergrad, but I need to go in a different direction. I think I'm meant to be a chiropractor. And my dad said, okay. And so I went and I took all my science classes, like chemistry and physics, without being able to see them, employing all those skills my mom taught me when I was younger of how to meet course objectives in a different way, how to feel things, how to be kinesthetic in my learning. And that's what led me into getting my first doctorate degree.
Wow. And if I may say so, this also awakened your sensories, because they say when one sensory goes down, then, there's this incredible awakening in the other elements. And I can just imagine how skilled you are through your hands. And obviously, you are very much about the profound insights of the mother archetype.
Yeah.
And you mentioned especially how unplanned cesarean sections can cause dissociation and trauma. But, I'm just wondering, where did you ever track perhaps anything yourself when you were in utero that may have been linked in with your own traumatic experience here, from obviously, as we say here, the journey through vision loss and healing?
Yeah, so first off, I was actually born through a cesarean section. And not having my mom now to ask why, I've asked my dad, and he's like, I don't know. That's what we were told we were doing. And I was the firstborn, and then my sisters were C-sections after that subsequently. Like, VBAC wasn't offered. But I have done all this healing work over the years of so many years of things like talk therapy, but then getting into more somatic and soulful based therapies, working with shamans and doing these soul returns and finding those different pieces of myself scattered. And one of them, when a really profound experience I had was envisioning myself in utero and the soul fragment that I had left behind from that, and my soul choosing this lifetime to lose my eyesight, was this big piece of garnet. And that was my mom's birthstone. She was a Capricorn born in January. So, or sorry, an Aquarius, actually. My dad's a Capricorn. And, but it was this big piece of garnet. And so I was like, wow, that's really related to my mom. And I was able to make meaning of that experience of my soul chose this. So I'm here to do something bigger. So however that looks for people, whether you journey back to your own in utero experience or however you're making meaning, having that kind of wisdom can be so helpful however you get there. So yeah, I that's what I truly believe.
I love that, because that gives us, because let's face it, there's always going to be some trauma while women are carrying their babies. And I know I had 3 babies, and I birthed 3 beautiful children, 2 cesarean myself. I think where I was fortunate is it was very much planned. So the doctor told me right from the get-go, this is what's going to happen. So I literally had prepared myself for it. But each and every pregnancy was different. And I found that my emotions were quite different from when I was, say, carrying my daughter through to when I was carrying my son. I had more of the masculine kind of energy around it, where I was very much in feminine. And then my 3rd child, I call her my chosen child. And the reason being is because, I had a lot of issues. She was unplanned. So she was our surprise. And, I believe that there were a lot of trauma right there in the wound when I was carrying her. And she finds it very difficult today to regulate her nervous system. So I love that you have spoken about being able to go back to utero and kind of recode or reinstall that whole experience. So what do you teach people? Do you usually help them through that visualization where they can literally go back into utero and recreate how that is?
Not necessarily where that's my intention, but that certainly happened when I'm doing body work or gentle chiropractic work with them, where they're dropped so deep in that they'll envision. I've had people imagine a different way of birthing their own child that was deeply meaningful and healing for them. So I really think that when we have the nervous system downregulated, because we're often in fight or flight and it needs it downregulated, that and we're more open to these experiences, then our psyche, which is connecting our unconscious to our conscious, can bridge that and perhaps show us those in utero experiences, whether it's in our waking life, in our mind's eye, or even in a dream. And so that's really where like the Jungian psychology, the depth psychology can come in as well. So paying attention. So I'll ask my patients about, what are you dreaming about these days? And that can be really insightful as well. These things show up, whether it's images or symbols or archetypes, all the time. We just have to ask different questions.
I love that. And the subconscious does process, our memories differently. Mm-hmm. And let's face it, most of our memories, we're just making them up now anyway. So even when we do, recall a trauma that is locked into our body, sure, our body has recorded that, and that's what's there until we go through a healing process. But on the other hand, when we're revisiting it also in our mind's eye, so if we're angry with someone or we've got a trauma that keeps coming up, guaranteed 100% that as we revisit that, we're going to add to it. We're going to subtract from it. It's never going to be exactly the way it was. So, let's face it, if we're going to make up stories and we're going to create this kind of trauma loop, why not then recreate it so that it's beautiful, so it's powerful, and it is something that is going to be more befitting to what we want in our life. So you also talk, and I never knew this and I never thought about this until you mentioned it, but you talk about women who disassociate from the scar of the cesarean. And I wonder if you can talk us through that and what makes a woman, like when I think about it now, the scar that I carry, it's like a badge of honor. This is where my 3 children were birthed. But come to think of it, it's untouchable. It's a no-go zone. So, can you tell us about that? What is it that causes women to go into that disassociation about that scar tissue?
There's so many reasons, and this is what brought me into my research for my PhD. My dissertation was on the lived experience of cesarean birth from a cross-cultural perspective. And I got so curious because what was showing up in my practice was unplanned cesarean births where they wouldn't touch the scar or anything below it. They weren't producing milk. And that's when I was realizing they were maybe disassociating from it or dismembering. And it was like nothing existed from that scar down. And they didn't, there was so much going on. And I was like, how can I help them remember that they're whole and complete? And that is a window to how they brought their babies earthside. So what can be going on is a couple things. Like from my interviews when I did my research, one person had to go under general anesthesia because the epidural and the spinal block didn't work. And I've had a patient have that happen recently as well. Ouch. And so when you have a cesarean birth under general, you're literally not there and present, and then you're watching a video to make meaning of that experience. That can be super traumatic. And then in terms of unplanned, a lot of people told me, I had a birth plan and C-section wasn't part of it, so I didn't pay attention to that part of my childbirth education class or the hospital tour. So they were really traumatized. And there's a lot of, at least in the US, like a lack of consent in ways of not telling them, oh, this medication is going to make you shake and feel really cold no matter how many hot blankets are on you. So then they're separated on their way to the OR, going through this liminal space, stepping through that threshold into motherhood, not knowing where their partner is because the partner might be scrubbing in. And that's really hard, that separation, being in that liminal space alone, shaking. So your body is going to try to like block out these memories. So a lot of it is protection. And, even with that scar and the way that the body puts down scar tissue, it's adhesing to parts of your body. And so that's a big reason I recommend scar massage and actually touching that area, but starting with like touching it through a washcloth, using different textures, maybe then getting cupping from an acupuncturist or a pelvic floor PT. So starting to engage with that area, but slowly. And the other thing you really should do is tell your birth story, because the research shows every time you tell it, you can find more and more wholeness. So it's complicated and complex, like every birth story.
Absolutely. And, because you are a chiropractor and obviously you're very much intuitive and you're working through your hands. And I know that my husband used to always say, God is doing his work through my hands. And he did a lot of, he was very intuitive. I talk about him like he's past tense, but actually it's not. He's just not practicing anymore. But the fact is that he would do a lot of the kinesiology with it. So he'd be able to read the back and the spine and their muscle and know where their trauma is. And in actual fact, I believe that played a huge role in releasing a lot of their pain in their body. How much pain are you dealing with in men and women that come to see you where there's a lot of pain? And do you find that it is trapped emotions held in the body?
It definitely can be. And I like to ask different questions. I'm not fixated on a pain scale, although that can be important information. It's not like my end all be all. I really like to know, like, what do you love? What are you not able to do when I'm talking about something like pain? And I also, because I studied Ayurvedic body work, I'll look at it from that perspective. I know some of the main meridians from traditional Chinese medicine, especially the lung meridian, and people hold a lot of grief there. So I'm able to name that and talk to them from that perspective. So I kind of see it in layers and how I experience them when they're on my chiropractic table. But absolutely trapped emotions in the body. We can see that show up in like Louise Hay's work, but also just the way that in TCM or Ayurveda or even Western anatomy and physiology, there's similar patterns for like the upper trap trigger point in the shoulder going up and around the ear behind the eye. That's the gallbladder meridian. That's frustration. So I really see it in layers. And all that fashion, how can we unwind that?
Wow. So you can kind of detect that the symptoms are as a result of unresolved issues. And I definitely have, I was talking on a podcast. I seem to have done a lot of podcasts this week, but the one that I did last night, the lady described that because my husband had out of control diabetes, and she associated that with not, life not being sweet enough, and that longing, like, and I do recall him always saying that he wished he had done that. Like, one of the things he used to always say is, I wish we had children together. And I wish that we'd done this. And I'm saying, well, why not just be happy where you're at rather than constantly longing for what you perceive? And he was a very optimistic, and I say past tense because obviously for people who know, he is in care now. But When you experience such a significant vision loss with this rare eye disease, do you believe that enhanced your sensory gifts?
Yes. Yeah. I feel that that's my embodied experience. And I also know that it's found in the research. They've done functional MRI studies where cells will migrate from one cortex to another when you have a diminished or lost sense. And so I absolutely feel that. Even for me, like memory is a sense. My family always calls me and they'll be like, Bethy, what happened this year? And I can remember. And I feel like it's a superpower, but I really think it's because I have this very like spaced in, zen in experience of like being very like in my embodiment. So I definitely feel that. And I feel that's why I'm able to work on babies, just use like the tip of my finger. And I have friends that are PTs and they're amazing practitioners and they'll bring their own babies to me and I'm like, feel that? And then they're like, oh yeah, now I feel that. And it's just, I feel it through like this little part of my finger because I'm just attuned that way.
That is incredible. And, you know, you obviously studied a lot of Carl Jung's work and, you know, going through the Webster certification. Can you talk us through some of the favourable Carl Jung theories that you bring to the table with what you give and what you offer?
Yeah, one of my favorite things within Jung's work is something he didn't write nearly enough about, in my opinion, and that's the unholy trinity, which really appealed to me as someone who was raised Catholic as well. He talks about the unholy trinity as these things that society doesn't want to talk about because it's like, you know what they talk about in like women who run with the wolves. It's the moist, the dampness, the things we want to like set aside. So Jung said it's the unconscious, the feminine, and the body. And when I first heard that in my master's to PhD classes, and that was a 6-year program, start to finish. I studied a lot of Jung. I was like, ooh, that's the juiciness of this program right there. I'm so interested. And so that's why I'll ask my patients what they're dreaming about, which is, you know, not your typical chiropractic question. But I'm wondering what's coming through. What are they learning from their dreams and that could help me give me some clues for what's going on in their physical body. And the unconscious, so that's unconscious, the feminine, and that's when we look at it as an energy, it's receptivity. Are they open? Is their heart space open? Are they really shut down with the way they're communicating and with their baby? Are they yelling on the phone while holding their baby and then wondering why their baby is constipated? You know, those things all are correlated for me. And then the body. And I think that if Jung would be alive today, he might want to consider changing the body to the soma because the soma, you know, proto-somatics, the soma is our lived experience. That's the first person subjective. And when we die, when we pass away, our body's left on the earth, but our soma is no longer there. And I think that soma has this beautiful life force part of it, which is so chiropractic as well, in chiropractic philosophy, that there's innate intelligence, there's a life force, this energy flowing through us that gives us that spark.
Oh, you're the real deal, girl.
Oh, I won the philosophy award.
A lot of the recent chiropractors that are up and coming have got no philosophy, and that really bothers me, you know. But I can hear you've got a lot of philosophy, and he was always banging on about innate intelligence and the innate intelligence, and that's why I'm a firm believer that since he always taught that the first thing that was laid down at birth is the central nervous system, and the innate intelligence of our body is truly a miracle to behold, then why on earth couldn't we surely heal something that we might be suffering, you know, an ailment, a back pain, diabetes, you know, whatever that happens to be. Because how much easier is that than actually creating the whole body and its innate intelligence, which is absolutely incredible. So you obviously are a strong advocate for the archetype of the mother.
Yeah.
And you focus in on the trauma. And obviously you deal with both men and women. I take it you would. And you found yourself, obviously, because everything is about the law of attraction, right? And we attract to us what is kind of an aligned match. So you attracted in the mother archetype and focused in on the trauma relating to birth and its long-term effects. What do you believe are some of the most commonest issues that may go unnoticed? Like, in other words, women don't even realize that they're dealing with this kind of trauma that happened at birth.
Oh my gosh. Well, you're so right at the beginning, because it's like, who better to deal with the mother archetype and trauma than somebody whose mother passed away when they're young in a traumatic way? And so, of course, it shows up. And, you know, and it's not even ironic. It's just like what it is. You know, with trauma, people will often share their birth stories, because I always ask, and I'll be listening and I want to be like, oh my gosh, that is so much trauma. But you don't want to say that when you're being trauma informed. So you just have to witness and hold space and help them, just guide them gently in their meaning making experience. And eventually they may realize, I had a lot of trauma. But I've listened to some very traumatic births and they don't realize it, because you don't know what you don't know. So if you're pushed into like a cascade of interventions and you didn't have somebody like a doula there to advocate and support you, which the research shows is the number one way to prevent birth trauma, you might not realize that getting a membrane sweep or having your water broken without consent is traumatic. In some cases, even obstetric violence. You just might not know that. So those are the things that I hear a lot, where it's like, then this happened, and then we gave you side attack, and we did Cervital, and those are the prostaglandins, and then we did this, and then, oh, now you're on Pitocin, it's really intense, and you know what? Your pelvis is actually the wrong shape, and it's too big or it's too small, your baby's too big, and there's all this mother blame game shame happening. And now we need to whisk you away for an emergency C-section. And so all of that can be traumatic. And those are stories I hear, especially with our cesarean birth rates in the United States and throughout the world as well.
Wow. What are the rates? Elizabeth?
A couple places that I know offhand within the Western Hemisphere, Canada's 26%. Most of the Caribbean in Latin America is 45%. Brazil's 55%. So I know those just because of all my research right offhand. But one that really stands out to me that's interesting is actually South Africa, because they have a public and a private hospital system, and their private hospital system, so people that can afford private care, is 77%.
Wow. That's
so
huge.
Yeah, and so we can look at it culturally, like in Brazil, they want to do a C-section before your belly pops at the end. Some cultures, it's about vaginal preservation. In India, there's this in the upper, echelons of society. People are meeting with their Vedic priests, like they pick their wedding time, picking the time of birth based on the astrology. So there's a lot happening.
I hear you. I hear you so much on that. With all my children, I chose the date and I thought, well, if I'm going to have a Caesar, I have the right. My first birth, which was a daughter, in the Burmese culture, which is where my father comes from originally, they believe that it's better not to have a child firstborn on a Saturday. Now, this is just a cultural belief, but because of that belief, I insisted she would be born on a Friday. And my third child, the girl, my doctor announced that he would deliver her on Halloween, and I said, hell no, that ain't happening. And, bless all the people born on Halloween, by the way. I have got a couple of friends.
Yeah.
I made that choice because really, I think you and I both know this a lot. It comes down to our belief system. So if we believe something, then we're going to make that true, so it is. So, with the Carl Jung concepts, the other concept is about the tension of opposites.
Yes.
Now, can you help navigate that one and how that is all kind of tied into what you do and your practices?
Yeah, so Carl Jung talked a lot about this tension of opposites, where maybe you're between two decisions and you're not sure which path to choose. And while you're in that decision-making space, the liminal space, it can be really uncomfortable. But what Jung would say is, that's okay. Sit with this discomfort and just be with it and be present with it, because eventually a third option will emerge. And so that's, so if we're looking at something like birth, it could be, I want to try to have a VBAC, a vaginal birth after cesarean, or I've already had a C-section, so like maybe that's easier. So it's like, what's that other option? Because that, babies are going to be born vaginally or through your belly. So the third option that may emerge is I'm going to try, trial labor in a really intentional way, but if I need a C-section, I'm actually going to be prepared with my own rituals this time, especially if it was unplanned the first time in an emergency situation. I'm going to have fake candles. I'm going to ask to choose the music in the operating theater. I might have some lavender or sage, clary sage oil or something with me, and make it really intentional. And so there's these other beautiful things you can do in these circumstances. And actually, there's a trend out of Australia the last few years called gentle or maternal focused, and with a clear curtain, and also maternal assisted is a thing coming out of Australia where the mom actually helps pull the baby out of that incision. So that I find really interesting as well, because maybe then your baby,
so actually pull it out of her own womb.
Really. Yeah, it's kind of like the myth of Gaia, like birthing
Don't
the world.
pull it the wrong way though, huh?
They'll guide you, but I think that's really cool. So talking about sitting that tension of opposites, there's something else that can happen that can make this a redemptive experience if you in fact had a traumatic experience the first time around.
Okay, so there's no such thing as a double bind then. We talk about double binds in NLP, would you like to go this way or would you like to go that way? And they have to make a choice. But I do, well, they don't have to, but that's the general conception. So what you're teaching here in the tension of opposites to help people navigate feelings of being pulled apart or feeling unworthy. And I have heard this, it's a bit of a theme because as I said, I've done a lot of podcasts this week, where, you sit with it and you be with it and you embrace it. And then, another opportunity comes along and how sweet that is. So, yeah. I actually have a beautiful friend who is soul birth. Her name's Faye, and she is on Edge Radio. So we branch out to Edge, and I believe she's got a Tuesday show. And I would truly love to put you together with Faye because she's just got so much knowledge, and I feel she would do what you're doing a lot of justice because she understands that work that you're doing. I mean, obviously, as a chiropractor, are you mostly in person or do you do anything virtual?
I'm really branching deeper into virtual embodied coaching and embodied leadership coaching. my new website will be launched soon with those offerings, so that I can work with more people and, impact more people. I'm also in the midst of a course that I'm creating with a really good friend of mine who's a doctor of PT. She's a pelvic floor PT, that we're putting together a somatic and trauma-informed birth prep course together that people will be able to do virtually. So I'm having more and more virtual offerings, as I'm fading, away a bit. So, some of my chiropractic hours, because I want to do other things and be able to be out in the world more. As much as I love that hands-on care and individual care.
Well, you've just got so much about you with your, incredible gifts, your Carl Jung theories, and even shamanic perspectives.
Yeah.
So let's dive a little bit deep into the shaman. I love this. The shamanic healers in Costa Rica and
the curanderas, yeah.
all that kind of jazz. So can you talk us through, because a lot of listeners may not even know what a shaman is. So let's go back to grassroots and talk deeply from the perspective of, what happens in the shamanic healing, and what does that mean for a person when they're experiencing this?
I would say if anyone ever calls themselves a shaman, go the other way, because a lot of times they're not. So be really clear. But shaman comes from Siberia, the word itself, and Spanish speaking countries they're called curanderas, but really they're hands-on healers or bone setters, which is the precursor to chiropractic found around the world in a lot of cultures still today in villages all over. And they might use herbs and local botanicals. And so I think it's a really interesting perspective, being able to see the world through like a spiritual lens as well. So I would never consider myself a shaman, but like if I was allowed to call myself a bone setter instead of a chiropractor, I would really love that.
What was that? Sorry, what was that? I missed that. I call yourself what?
A bone setter.
A bone setter.
I love being Mike. I want to be a priestess bone setter. That's way more exciting to me.
Priestess bone setter. That is so good. I know that, I guess the more you become unique and original and the more niche down you become too, that is just so incredibly powerful. Yeah. So now, how do dreams reflect into our life and some of those shamanic perspectives?
Oh, I want to share a little story about that. I had a dream when I was about 6 months into my program for my master's and PhD. I was dissolving my initial practice with a business partner. That was a really toxic, bad situation for me, building a new practice and in school. And I have this dream where I'm being surrounded by a snake. But it started in the middle of my spine. It came out of my spine. So whenever I say that, people think Kundalini, but Kundalini isn't my thing. And it wraps around me, and I literally sit up in waking life it wakes me up because it freaks me out. And I go, this is a message from Psyche. Like I yell this out loud. And so I'm like, what was this dream? So I go and I meet with my therapist because when I was getting my master's, we were required to be in therapy a certain amount of hours. And so I'm like, I was sitting in this yurt working this dream, like going back in, being in a place of active imagination, which is a Jungian principle of, it's that liminal space. You're there, you're engaging with the snake. And I'm like talking to them, but I'm kind of in a half meditative state. So I worked this over and over, going over the dream so many times. And eventually I witnessed the snake fully wrap around me and then lower itself into the earth. And it leaves me its tail, and its tail is a rattle. And I was like, whoa, this is an initiation, right? And so then I eventually, soon after, at a yoga festival, meet somebody, and he's, I believe we have multiple soulmates, and I meet this guy, and it's really magical, and we learn a lot from each other. But as our journey came to an end the next year, we're traveling to Mexico, and I get out of the car, and there's an actual rattlesnake. And
Oh,
it felt, I was like, okay, I think this journey is complete with him. Like, my soul learned what I needed to in this partnership in this time. So that's
mm,
how I engage with dreams. And it's not always like that, though. When I usually have this sense, this felt sense in my being of like, this is a big dream. And that's when I'll write it down. I'll voice memo it to myself. And I might paint it. I might put on music and dance with it. I want to engage with that, and that's an archetypal thing to do. And you don't want it to let it overcome you, but you want to come into a relationship with it. And so, there's books on dream tending that I by Stephen Eisenstadt. He was the person who founded Pacifica, where I got my PhD. It's literally called Dream Tending, and that teaches you how to do that and how to tend to your dreams.
amazing.
So,
Look, and they can be very prophetic. I can remember
mhm,
about 15 years old and having a dream where I was surrounded in pygmies,
mm,
and they were all these evil little people. And, it was quite a scary dream. And I remember waking up and telling my mother, and my mother's always been a spiritual person. She transitioned from clairvoyancy into Christianity. And, she basically told me things about myself when I was a young girl that actually did come to pass. But
mhm,
she transmuted that gift into prophecy
mhm,
and healing. And when I was 15, she was definitely that strong Christian. And she said, Terry, I think this is a warning. But the interesting part was that I'd had a short person come to the door, and I'm a short person too. I mean, I'm not short, but
mhm,
I'm about 158 centimeters tall. So this short person followed by another one, and next thing I'm surrounded by, and a lot of them were guys,
mhm,
but there was also a lot of evil that took place. There was a lot of bad stuff that happened, and reflecting back on it, I went, oh, that dream. And it was a warning. And as a hypnotherapist today,
mhm,
I'm aware that dreams don't always mean what they seem, but they can be very metaphoric. So it can be
mhm.
speaking, a language of its own. So, I want to ask you the final question, and it just wouldn't be fair for me not to ask this because it's, you get heated up, and I feel that if anybody only had 15 minutes to listen to a podcast or a video, go to the middle to the end because that's where momentum is built and
Yeah.
everybody gets into it. So, what is the one thing that you haven't shared on this show today that you would love to share with someone out there that is perhaps praying to meet someone like yourself in the
Mhm.
field you do? What would you say to them that, really can give them some insight?
Everybody has challenges. I don't think anyone gets through this life unscathed from some sort of trauma. And you don't have to identify fully with that trauma, but like I said, be in relationship with it, learn from it. And so from that challenge, hold that tension of opposites, like we've talked about already, because something else may emerge. And for me, my challenge has been losing my physical eyesight, but I gained this huge vision for myself and for the world. And I'm able to be in a career where I don't need my eyes or my eyesight. I use my hands and my heart and my third eye intuition, really tapping in and witnessing and holding space for other people. And this didn't happen overnight. I did a lot of work, all sorts of therapy, from talk therapy to EMDR, somatics, became a $500 yoga teacher. But, you know, another example right there, like if I can become a yoga teacher without being able to see, I really think anything's possible. And, or getting,
We've got a Helen Keller in the making here.
Yeah,
And
I mean,
a profound woman,
yeah, so I think turning your challenge into your greatest strength is the best thing you can do, a gift to your soul, but really a gift to others.
Absolutely. So turn your pain into your power and your work into your wisdom. That's what the Genius Zone is all about. You know, every person that comes on this show, it's all about their beginnings, where they started, how they have been able to transmute that and, you know, bring it into their power of genius. And that's a very healing aspect right there just in itself. So how will people find you? Now, firstly, we will be putting all your links into the show notes. So make sure you do get in touch with this beautiful lady. And where would you like to recommend people will find you?
First would be Instagram at Dr. Elizabeth Wisniewski. And on there, you'll see my link tree because I have a new webpage with a new domain coming out soon. So if you're following me on Instagram, you'll get all of that. That's really the best way to engage with me. You know, send me a DM on there. But also, I have a tech platform I'm actually the president of called Dream Planet. And that's another great place, especially if you're a creative and artist. Find me as Dr. E. Queen Dream on Dream Planet.
I love that. I love that.
Yeah.
So I love those letters after your name: DC, Doctor of Chiropractic, PhD in Somatic Depth Psychology. Thank you so very much, Elizabeth. It has been an absolute pleasure to have you on the show.
Thank you. This has been so wonderful. I really appreciate it.
Okay, let's go.